Hi, everybody. This is Dr. Eliana Aaron, Director of EMA Care. I hope everyone's doing well. Today, I'm going to talk about a couple of trends that are going on right now that we're looking out for globally. And the global trends are extremely important when we're thinking about where we are in Israel and where we are trying to get in terms of tourism. We need to really look at those global trends to understand where the dangers lie and what we can learn from them. So we're going to talk about that. And we're also going to talk about where these graphs come from and why the visual graph is so important for understanding epidemiology. So a little bit of history. So first of all, about the trends, Western Europe is on the decline for the most part. We're going to talk about a couple of exceptions. They peaked a few weeks ago, around the same time Israel did. And now we're seeing a decline. It doesn't mean that they don't have a lot of new cases, but relative to where the rate of new cases they had a few weeks ago, they're doing much better. So England, for example, the United Kingdom is currently still a very, they're getting, 3,400 new cases a day, but they were getting more. And Russia is really the biggest concern because that's Eastern Europe. So Western Europe is kind of on the decline, even though it may not seem that way for each country. Still very concerned about the United Kingdom. Still very concerned about a couple of others. Spain is on the decline. They're still getting over 1,000 cases a day. Russia has over 10,000 cases a day, new cases. And they are very soon going to surpass all the other European states. And that's obviously very concerning because they've climbed up that chain very, very fast. They're starting to see over 100 deaths a day. So there's a lot of concern about what's going on there. It's a very big country, and the resources there are scattered in a lot of different places. The cities have more resources than the rural areas, obviously, like most countries. But because it's such a big country, this can be problematic. Why am I worried about Russia? Because there's a lot of, typically, on a non-COVID year, there's a lot of flights to Russia, a lot of business with Russia, a lot of Russians in Israel who want to visit relatives, et cetera. There's a lot of medical tourism from Russia as well. So that's a big source of tourism for Israel, and right now they're getting smashed. So what we're seeing is Eastern European countries are really starting to peak. I wouldn't even say they're at their peak, but they're going up very quickly. That includes Poland. Poland just surpassed Israel in the number of cases like a day or two ago, and they're seeing hundreds of cases a day. Again, Eastern Europe, even though a lot of those countries are part of the EU, they are poor countries for the most part. So these are things that we need to continue looking at in terms of regional stability for the coronavirus. I expect that over the next few weeks, we're going to start seeing that peak and then the decline. So when we start talking about reopening tourism by mid-June, it may not be to some of those countries that are still really up there, but Western Europe by that time, for the most part, should be in decent shape to start thinking about some of those things we discussed yesterday. The exception is that there's an article that just came out of Germany. Germany just started reopening the economy. They're doing it in stages like most countries, but what happened is that in the few days since that reopened, they've seen an upsurge by threefold of the cases that were being diagnosed. So we don't know if that's coincidence. Remember, you can have these little blips, although 3 times the amount is not a little blip. It's something that's being looked at. And then the question is, did they open too quickly? Remember, Germany was considered a country that had an excellent relative to Western European countries, was considered a model. And they had a relatively low death rate compared to other European countries. and they were really controlling it very well, even though they've had a lot of cases. They've had 172,000 cases. Relative to others, they were doing pretty well. So this is a big blow for them, and they are evaluating, and they may need a couple more days to evaluate that, but they're evaluating, you know, if the reopening of the economy has done good or not so good by those standards. So in Israel, you know, we opened our economy about 16 days ago is when we really started opening. The stores opened. There's this thing called Tav Segol, which is all the businesses that open have to meet certain criteria in order to open. They have to make sure that nobody works there is sick. People have to wear masks. They have to have alcohol available for their customers and for their employees. They have to have plastic guards up when you check out in a store. And I went to a couple stores today to see what was going on. And for the most part, the stores are compliant. There were a few people without masks or with masks around their neck. I love that because your neck breathes so much, right? Or, you know, the mask that's here but not over the nose. You know, and being a health professional, I, of course, say something to everybody. And I always hear like, oh, it's so hard to put it on my nose all the time. You know, it's also hard to be an ICU doctor like my brother and to wear a spacesuit, but none of us want to do this, but this is what has to happen. And you know what? There are so many unemployed people in Israel right now. If you can't do it, get someone who will, because I bet you there are 100 people for every job, every employee who says it's too hard to wear a mask all the time. So that a little bit drove me crazy. There were a couple of incidences where the marks on the floor, you have to have marks on the floor where people should stand 2 meters apart. They weren't 2 meters apart, they were a meter apart. So, you know, I keep my distance and I do what I need to do. But for the most part, I would say that people are being careful. Most people were wearing masks and properly. And I was pretty comfortable. I didn't feel like I was in danger. So that's pretty good. Now, considering all that, in the last week, our average daily new cases was 34, which is really good. At the end of April, the last 2 weeks of April, we had an average of 263 new cases every single day. And the beginning of April, we had 477 cases. So that's blocks of time, okay, where we saw those surges up. You can see in the WhatsApp groups and in some of the graphs that I put some of the 2-week averages. I'm going to make it a more sophisticated chart, but I think it's important to look at those 2-week averages, especially since 2 weeks is the incubation period. So if we think about 2 weeks ago, we opened the economy and we are still, thank goodness, at a very low new cases rate. That tells me that the speed in which that we are opening so far looks to be safe. Now, that can change. Remember, we've opened multiple things on multiple days and I'm trying to track it. For example, the nursery schools opened up only a few days ago. So we really need to see in the next week and a half how that's going to start looking and if that's going to have an impact. The day after they opened, there was already a case of coronavirus in a nursery school, which caused the nursery school to close. So I think that there's still a little more time that we need, and each step that we take to open things up has to be evaluated properly. There is now a plan to bring in the 4th through 8th graders back to school. They will be going to school part-time in small groups, few hours a week, and it's going to be a gradual reintroduction into the system. And I think that's a very smart approach. Those are kids, why didn't they start school already? Because the 1st through 3rd graders need to have a parent at home when they are not in school. So those parents couldn't go to work. Now that we're opening up the workplaces, the older children, in theory, could stay home by themselves. And so it was less of a priority. So they got the younger kids in. They've been in school now for about 10 days. So far, so good. And now we need to see how it's going to work integrating the older kids. Remember, the older kids have a higher rate of getting coronavirus and spreading it. So once you're at the over 9 years old, there is a different epidemiological impact. So I think that's the reason why it was divided this way. I'm going to briefly just talk about the graphs and why they are so important, the visuals to understanding what's going on. So I'm going to introduce you to my friend here. This is Florence Nightingale. It is her 200th birthday today. I'm a big fan of Florence. She was the founder of nursing, but she was also one of the founders of epidemiology. And she became famous, you know, when she was a young nurse, by evaluating how British soldiers were dying and what they were dying of during the Crimean War. So she developed a diagram, which was one of the first of its kind, to prove that that people were dying more. Here, this is her actual graph, and the gray represents people dying of illnesses that had nothing to do with their war injury. They were dying of poor hygiene and lack of fresh water and good food and the filth that they were living in that was causing all kinds of diseases. The black here was people that died of actual war injuries. So you can see a lot more people were dying. This is a very interesting graph, and she was playing around with graphs. But what she showed here is that once her interventions went into place, that the scale got much smaller and a lot less people died. So she was able to actually prove and show visually how important it is that that her intervention worked, and she was able to actually completely change the way medicine is practiced. Remember that until that period of time, people did not believe it was safe to wash your hands and to bathe and to be clean because the water was going to give you bad humors, and having blood on your hands for a doctor when he's doing surgery was good. And then you don't wash your hands when you go to the next patient. So she changed all of that, and we owe public health and hygiene to Florence Nightingale. This is another one of her charts to show that even after the war, the health conditions of the army were so poor that people were dying at much higher rates, double the rates of the average typical Englishman. And she was able to prove that by changing the hygiene, that she was able to actually do that. So to make some good changes and to apply public health to non-war situations. So why am I saying this? Because when we look at the charts that that I typically put out, having that visual is extremely important in seeing the comparisons of where we were, where we are, and where we're going. Seeing how we fit into the global picture. And most people learn visually. Some people learn in other ways, but it's very important to use your senses. So not just hearing someone talk, but actually seeing it is very important. And that's why the graphs that were invented by my 200-year-old friend Florence Nightingale are actually very important today. So I wanted to share that, and I hope everyone continues to do well and stay safe, use good judgment when going out, and I'll be back. Take care.